Today, the World Health Organization said it continues to support the use of the AstraZeneca vaccine. This after more than a dozen European countries have temporarily stopped using it while they investigate reports of rare but serious blood clots.
Scientists are now racing to determine whether the vaccine is to blame. Our ABC 10 News anchor Derek Stahl is going in depth to explain how they'll do it.
More than 17 million people in the UK and Europe have now gotten the AstraZeneca vaccine. And the company says a total of 37 people developed blood clots as of last week. A few of those cases resulted in death. So with the vaccine likely coming up for a review by the FDA in the next few weeks, should we be worried?
I think it's very unlikely that this vaccine is responsible for the clotting that's been seen in any respect.
Dr. Peter Chin-Hong is an infectious disease expert at UC San Francisco.
In fact, forming clots or thrombosis, as we say in medicine, it's not a vaccine thing, actually. It's not something we've seen historically with other vaccines.
Still, European regulators say they want to investigate as a precaution. They'll start by comparing the rate of clotting in vaccinated people to what's called the background rate. That's how often you'd expect blood clots in the general population. In the U.S., about 1,000 to 2,000 people get a blood clot every day for a variety of reasons.
When you're vaccinating literally millions of people, things are going to happen. People are going to die from other causes. People are going to have clots just like they would in the general population.
Dr. Christian Ramers of Family Health Centers of San Diego points out the rate of blood clots in people who got the AstraZeneca vaccine is much lower than you'd expect in the general population. But he says the numbers change slightly if you start looking at the exact type of blood clots. To give you a sense of just how slight we're talking, regulators are now focusing on 7 cases of a rare brain blood clot that popped up in Germany after 1.6 million people got vaccinated. The normal rate of that kind of blood clot is about 5 cases per million.
Regardless of how you slice and dice it, this is a very rare thing. And it's really difficult to disentangle what's background rate and what's vaccine associated with something so super rare.
Scientists will be reviewing each person's medical history for clues. In the meantime, dozens of countries are continuing to roll out the shots, including the UK, Canada, and Australia.
Overall, remember that you're having to balance risks and benefits. And there are still thousands of people in Europe dying in many countries in Europe where the surge is now recurring, actually.
This controversy over AstraZeneca could be settled soon. The European Medicines Agency is holding a meeting on this topic tomorrow. Derek Stahl, ABC 10 News.
AstraZeneca is also facing pressure after a new study found it is just 10% effective against the South Africa variant. The vaccine is not used in the U.S. right now, but it is expected to go before the FDA here in the next 3 to 4 weeks.